severe counterindications of taking, is that the right word? I'm not a doctor, obviously, but there won't be much negative interaction between cannabis and other drugs in case they do need other medicine for other conditions that aren't treated through cannabis.
Correct. If you go on drugs.com and you type in cannabis and drug interactions, you'll see very few drug interactions. So it's very easy to introduce cannabis into someone's treatment regimen because of the lack of contraindications with other medicines. So because of that, I don't have very much fear when I'm prescribing medication to someone who's already on an antidepressant. And in fact, on that note, one thing that I find cannabis to be very effective for is for patients coming off of antidepressants. So you can use it. You can use cannabis, particularly cannabidiol, CBD, as a monotherapy for treating depression. But the other thing that you can also do is you can help eliminate or reduce some of the negative side effects a lot of patients get when coming off of these medications. And Rahul mentioned earlier about the antidepressants as well. And I have a very difficult time getting some of my patients off of these antidepressant medications, particularly Effexor and Paxil will probably be the two that I find patients have the most difficulty with. And then the withdrawal effects that they get are really difficult to treat, and their effects that are really specific to SSRI or SNRI withdrawals, antidepressant withdrawals. A lot of patients will report brain zaps. If you type in antidepressant withdrawal symptoms, that'll be one of the first things that come up. A lot of people also get a lot of different mood changes with it, and they just don't feel themselves. So in anticipation of a patient coming off of an antidepressant, you really want to have a good game plan there, because otherwise they can really be in a lot of hurt for a few weeks when they're coming off of it. So I have found that cannabis, in particular high CBD, has been excellent at reducing some of those symptoms and at treating the overall depression and anxiety.
And the same could be said for coming off of opiates, too. I recently interviewed Dr. Gina Berman, who has actually opened up treatment clinics for people who are coming off of opiate addiction or trying to diminish the effects of withdrawal and actually wean themselves off of prescribed opiates. And she's just astonished by the results and how effective it is, and how some people will actually come off of the medicine on their own after introducing cannabis as an alternative. Have you found the same thing to be true?
Absolutely, Snowden. I have patients that were on opiates that were put on a methadone program, and unfortunately on that methadone program they were unsuccessful at getting off opiates and at getting off methadone, and then they come to me, and then I'm able to get them off their opiates, and I'm able to get them off methadone if they've switched from OxyContin or Tramadol or something to methadone. I'm able to get them off methadone as well. So I find that cannabis is good in all stages of coming off of opiates. So patients who are currently taking a pile of different opiates that are being used for pain, a lot of patients can actually use cannabis in place of those medications, and they're able to come off opioids that way. And then I have another group of patients who were, again, taking things like Tramadol or Oxyneo, OxyContin. Then they were placed into a methadone clinic, but they couldn't kick the methadone. They were able to kick their other opiates, but now they're not able to kick the methadone. So with cannabis, we can actually get patients off of methadone as well. So it doesn't really matter what spectrum you fall under, whether it's a severe opioid addiction that's concurrently going on, whether you're just coming off of methadone. Cannabis seems to be effective for all different types of patients.
Dr. Kushwaha, when we were talking about the addictive nature of it, obviously the psychological addiction is far less deleterious to someone who's trying to kick the... It's more habitual, wouldn't you say? Or...
Well, yeah, I mean, totally. That's part of it. But let's say if we talk about opioids in general, I mean, for the physician community to really grab onto medical cannabis and use it as a widespread treatment, there's a lot of fear factor which is involved there, because the thing is, with other medications like antibiotics or a lot of psychotic medications, you can do a genetic test and you can identify if it's going to work, if it's going to work well, or if it will cause an adverse effect. But with a lot of physicians, because they have been prescribing opioids for so long, to an extent, they're feeling a lot more comfortable prescribing opioids versus cannabis. And that's where, again, genetic tests can come into the picture to really help them identify that, okay, this patient completely has the all clear, and we can, in fact, move this patient from opioids to medical cannabis. And the other flip side to that is that, of course, in few of the patients, it's going to be the other way around, whereby they could be highly prone to developing cognitive deficits with cannabis use based on the outcome of genetic test. And in those patients, maybe it's not the greatest idea to directly move them over to cannabis. But again, with the widespread research that's happening with cannabis strains, with the levels of CBD and THC, perhaps down the road, strains can be engineered to better impact that population base as well, which is highly prone to these adverse effects.
So it'll be interesting to watch what happens as this becomes more and more common. Do you anticipate that this is going to be sort of a widespread tool for physicians?
Yes, that seems to be the case. So from the addiction clinics, for instance, there is actually a lot of openness to embracing the genetic tests that we are offering.
That'll be a really interesting thing to follow, and I anticipate we'll hear a lot more from that as well. And in terms of regenerative medicine, and as opposed to just preventative medicine, what's been your experience in seeing how cannabis has curative effects as well as like just relieving symptoms versus some of the other drugs that are most commonly prescribed?
So one of the biggest problems for the research side has been that there hasn't been a lot of research that can be done with cannabis because, again, it's a prohibited substance. So as Mike was saying, that you go on drugs.com, for instance, you see a very few interactions there with cannabis. But again, it could be that maybe those interactions are not even there to start off with. And part of the reason is not enough research has been carried out. So that's something which is really sort of stalling work as far as regenerative medicine goes, because again, when you talk about the endocannabinoid pathway, the receptors are expressed in a lot of key tissues and cells. So really from a regenerative medicine standpoint, such as stem cell work, I mean, cannabis and the endocannabinoid system does play a very strong role. But again, how it does, that still needs to be figured out. And with the steps that we are taking towards genetic testing, what that's allowing us to do is really to develop the first database of genes or of genetic data of individuals, let's say based on their endocannabinoid profile, if they're prone to adverse effects, if they're not. So once we reach a certain critical mass, the data that we are gathering can actually be reprobed, and it can really help not just in progression of preventive medicine, but also regenerative medicine at the same time.
Very interesting. It really is. So, Dr. Hart, are you finding that patients are receptive to suggestions about cannabis in your practice?
I think that they're becoming more and more receptive. I think that, first of all, cannabis was really only started to be prescribed heavily in Canada in 2014. So it's just been about 3 years. So initially there was definitely a lot of resistance, but over the last year or so in particular, it's really opened up. That being said, though, Snowden, I think I heard recently that only 9% of physicians in Canada are prescribing cannabis at this point. So clearly a lot of physicians still don't feel comfortable with it. And I think that the reason is because, unfortunately, in Canada anyway, cannabis is not in a lot of the guidelines. And when it is in the guidelines, it's to be used as a last line agent. So there's still patients that come to me that say that they went to their doctor and they asked for a prescription for cannabis or asked for some information on it, and they were told that they can't get a prescription or can't be given any information because they haven't failed all of the other drugs. So it's literally written in the guidelines that a patient must fail something like NSAIDs, like non-steroidal anti-inflammatories, like Advil, or then even harsher medications like we've been discussing, opioids. Like they actually have been told, patients have been told that you need to try opioids first. And if opioids don't work, then I can prescribe you cannabis. So, a lot of physicians have a lot of resistance with this, but unfortunately, at the end of the day, a lot of physicians just want to give into the guidelines and to prescribe based upon the guidelines. And that's probably why you still have that number at 9% in Canada. I would say, Snowden, though, if we got more education out there, and if cannabis was considered to be a first or a second line treatment, then physicians would probably prescribe it a lot more freely than they are now.
And when you're saying prescribe, see, in the United States, using the term talking about cannabis, it's completely against the law on a federal level here. And it seems that Canada has a much more open policy about that. Is that correct?
Well, I'm not sure if I can really compare the two in a way, because I think ours is more federally, whereas yours is more by state by state.
Right.
What I understand. But I think that Canada as a whole has always been, on the forefront of cannabis. But unfortunately, at this point, and as Rahul has mentioned, there really hasn't been too much research done in Canada, and a lot of the research that's being done on cannabis now is actually being done in Israel, and they're really becoming the nation that's on the forefront in cannabis, which is unfortunate because Canada has long been associated with cannabis and with growing really great marijuana. So with great marijuana, you can definitely do a lot of great research. So I certainly hope that changes in the very near future.
And in the schools there, the medical schools, are they beginning to actually cover the endocannabinoid system at this point, or is it still like it is here in the States where only a handful of medical schools actually talk about cannabis at all in their required coursework?
Yeah, from what I understand, Snowden, there's basically no medical education on cannabis in Canada right now because it's not really considered to be a first-line agent. And because of that, most of the curriculum is still not focusing on cannabis as a medicine.
Yeah, and therein, I guess, would be, the crux of the problem, too. And education, like you said, is just crucial at this point. And it is here, too. I mean, yeah, it doesn't cease to amaze me that it's not a required course, being such a major system in our body.
So just yesterday, I was having a discussion with the deans of one of the top medical schools in Canada, and we were talking about the endocannabinoid pathway, and that's what I brought up. I'm like, there is no formal education that's being carried out at any universities. And you know what he said? He's like, because there isn't a lot of research that's being done along those lines. And again, doing research along those lines is being hampered by the fact that if, let's say, you're a federal researcher, you just cannot go on and openly research with cannabis.
Mm-hmm.
So it's more of a catch-22 that, yes, they want more information in research papers on endocannabinoid pathway, but to do that research, you need to work with cannabis, which is not being done actively in Canada.
Yeah, it's such a shame. And I think you were saying, Dr. Hart, about Israel But yes, there's so much research being done overseas, and a lot of these papers are published here in the United States and in Canada, I would imagine, as well. So it's just amazing to me